Hey everybody, my name is Barb. I'm 40 years old. I just underwent total right hip replacement surgery on March 2nd, which was 16 days ago. I wanted to share with you guys a little bit of my journey. I'm going to start by saying that I'm not a doctor, I'm not a therapist. Nothing that I say is meant to diagnose or treat any kind of injury or illness. I'm just sharing my story with you and hoping that I can help you to find your own path. So I'm actually having a bad day today, which is okay. It happens, but for the most part, I've had a really advanced recovery, a really good recovery. A huge part of that is that I did all of my PT leading up to my surgery. My doctors gave me an app that I could just go on and watch some videos and do some physical therapy at home. Really basic, easy stuff. I overdid it. I was not injured other than my arthritis. I didn't have anything wrong with me. So I was not feeling a strain from those exercises. So I tried doing a lot more than I was supposed to do, and I ended up hurting myself. So do whatever your doctor is prescribing you to do, but make sure that you do it. And then I was also walking a lot. I still have a lot of my mobility. Obviously, I'm young, relatively in shape. And I was able to go out with my meloxicam. I had meloxicam, so that was taking down a lot of the inflammation and the pain. So I was able to go out into my neighborhood, and I was walking 5, sometimes up to 10 miles a day leading up to surgery, getting my body in the best shape that I could possibly be in before I had surgery so that I would have the best chance of success afterwards. Since my surgery, I had about 2 days where I was on oxycodone. I was kind of laid out. I was doing what I was told to do, which was get up every hour or so and just walk to the kitchen. I had a walker at that time. You can see my crutches in the background. I'm not using those anymore either. Just every once in a while, I'll pull them out just to get my gait correct. But after 15, 16 days, I'm able to walk pretty well without any assistance at all. Having shoes on helps. When I'm barefoot, I feel a little bit off balance. I got Merrell shoes. I don't know if you can see them, but they're hiking shoes. That's my left leg that I'm picking up that high, by the way. But anyway, I'm wearing Merrell hiking shoes with Superfeet inserts. Superfeet are really awesome. It's like, you can get Dr. Scholl's or whatever, at Walmart, but the way these sit in the shoe and the way that they're so firm, they're really going to give you a lot of support. And I just prefer them. They're expensive. They're like $50, but the shoes are like $80. To me, $130 or whatever I ended up spending is well worth having my feet feel comfortable and my legs feel supported while I'm recovering. So getting good footwear was part of my recovery, but the biggest thing for me has just been every single day treating my recovery like it's my job. Even if I'm at a point where I'm only able to lay in bed, which was only the first 2 days. Like I said, I took that oxycodone for 2 days and then I weaned myself off. I think I might have taken it the second night as well, and the third day I stopped taking it. So I was on 800 milligram ibuprofen and 2 extra strength Tylenol, and then I take gabapentin at night. But obviously take whatever you're prescribed to take, and check with your doctor if you're taking any extra supplements or anything like that. I'm taking some CBD as well as some bone and joint support pills, and I take curcumin to help again with the inflammation. But ask your doctor. Don't take my word for it. Ask them. I do think the CBD helps a lot. And it's not marijuana. It's just CBD. You don't get high. It just helps your body to heal. So anyway, what I've been doing is every day I do a lot of deep breathing exercises. And when I'm talking about deep breathing, if you haven't done deep breathing exercises before, you're not breathing into your chest, you're breathing down into your abdomen. So, and you'll feel it, you'll get chills, you'll feel that expansion, your rib cage opening up, and your diaphragm dropping down. And that's what you want to go for. You want to get nice full breaths. One of the things that can help you to get those nice full breaths is to blow out really, not hard, but completely. So when you blow all the air that's in your lungs out, you're kind of creating a vacuum so you can breathe a lot of air in. Now, what that's doing for you, first of all, it's oxygenating your blood, which is great. Secondly, that deep breathing is relaxing you, and it's also causing your muscles to be able to relax a little bit too. Especially that out breath can be really really helpful in allowing you to stretch farther, or allowing you to really let go of a muscle area. So if you are doing what I'm about to show you, the out breaths are going to help you to relax into the stretch that you're doing. So I'm just going to take this straight into the next thing that I've been doing, which is trying to keep my body loose. One of the things that I've seen people in my support groups doing that I feel like it's an impediment to their recovery is that they overprotect the area, they over-rest the area, they allow for atrophy, they allow for stiffness to continue getting worse and worse. And I'm going to repeat, don't do anything that I'm doing without talking to your doctor or your physical therapist first. But for me, keeping not just the joint that was operated on, but all of my joints, my back, my other leg, my arms, my neck, keeping everything loose has really helped my recovery, because I'm able to move like I did before my surgery. And when I stay in bed and I don't stretch and I don't breathe, I feel that. And I can only imagine what it would be like if I did that day after day after day and it built up. So what I do instead is I get up out of bed, I come in here in my living room, and I just start breathing and bending. Remember to keep those breaths down here in your abdomen. Now, you might not think that your neck has anything to do with your hip, but everything is connected. Your body is connected with all of this internal connective tissue, and fascia, which is the outside skin around your muscle, the kind of outer connective tissue. That stuff's really all connected throughout your body. I mean, you could have something wrong with your shoulder and it's pulling up, on that hip, or you could have something wrong with this part of your neck and that fascia's pulling up on the shoulder. You're pulling up and then it's coming down to the hip. It tends to work in kind of like a zigzag. So like if this side of your neck, this side of your chest, this side of your hip, this side to your knee, to your ankle, right? So it works in zigzags, but it's all connected. You can have something wrong with your shoulder that hurts the same side of your lower back. The point is, it's all connected, and you're going to feel general relief if you start working from your head and work on down to your toes. So what I'm going to show you right now is just a very simple way of stretching your back. And if you're doing this, my biggest advice to you, my biggest point that I want to make, please pay attention to your body. If you feel something that's stiff, that feels like it's being overstretched, that feels like it's about to hurt, stop and take one of those really deep breaths and hold it. And then let it out kind of quick. And then take another deep breath and hold it and let it out. And what that's going to do is give that muscle a chance to relax. So let's go ahead and start. Let's do just a very basic slow ragdoll stretch. So what I'm going to be doing is slowly bending over, starting from my cervical spine into my thoracic spine and on down, all right? So I'm going to start out, I'm going to push your shoulders forward, bring them up, back, and let them drop. You're gonna take your head, get that breath going, and we're just gonna let our head fall forward. Just let it fall forward. I'm not doing anything intentional. You'll feel your shoulders kind of follow, that's fine. And just feel if you got a little stretch in your neck and your shoulders right there. And I want you to take that nice deep breath into your belly, okay? You can kind of feel yourself sink into that. Now I want you to make sure that your knees are not locked, that your knees are soft. All right? Now try and just keep your body very balanced over your hips and your knees as you do this. Next, we're going to just go a little bit further and let that cervical spine curl down a little bit more, starting to get into the thoracic, all right? And just breathe into that. And drop. And now just hold there and breathe again. And you'll feel yourself sink. If you feel like you need someone to spot you, please have them spot you. If you feel like you're not balanced, don't do this. Or use stand near a wall or something so that you don't fall. Now we're going to take another breath and we're going to go just a little deeper. We're kind of thinking about it like each vertebrae one at a time. We're releasing. And make sure that your head and your arms have that ragdoll quality where if you kind of shake yourself, it just all kind of moves on its own, all right? We're going to do one more level of vertebrae. Ready? Take a deep breath and then let it out slow. And hold it here and do another breath. Feel yourself dropping down a little bit more. Now I just felt a nice little release in my sacrum, which is great because I've been super tight through there. It was on my left side and my right's the one that's really a problem, but it's nice to feel that opening up. Now this time I want you to take a nice deep breath, real deep, and I want you to hold it. So get that air out of your lungs first, really purge, and then go in. Hold it. Stay relaxed and then let it out. That feels nice. You sink in there. Just continue to do this. Nice and deep. Dropping in. Staying loose in those knees. Staying centered. Keeping your balance. Keeping your head and your arms nice and loose. And do another breath. Get it all out first and then get a nice deep one. And drop. At this point, you should probably be around your 90 degrees. If you've had posterior surgery, you're not going any farther. If you've had anterior surgery, like I did, we can go farther if our doctor has said that that's okay. Mine has, so we're going to keep going. If you've had posterior surgery, I just want you to stay here and take a few deep breaths and then start to reverse the process and go back up, okay? As we're taking these nice deep breaths, anterior people go with me if your doctor says it's okay. Ready? Nice deep breath. And out. And down. And now you're starting to get that nice low back release. Yeah, that's nice. And you're sinking in. Now you're going to do that real deep breath. So you're going to push all the way out, do the deep breath, and then hold it. Make sure you're nice and loose, nice and limp, holding that breath in and letting those arms hang, and then blow out. You're going to feel that
in your lower back and in your sacrum. It feels great. You can move that head around a little, but just kind of try and still keep everything in ragdoll. All right, and I think we're far enough. Some of us are more flexible if you are, and I could go down, but I'm going to reverse it so that everybody is kind of staying together. So the next thing we're going to do is, as we take that deep breath in, we're going to come up just a hair, all right? Nice deep breath in and up, and let it out. Stay where you are. And then take another deep breath and come up one more vertebrae. Let it out. Stay where you are. Again. Up. And then breathing out. And you're going to feel your back is appreciating this. It's opening up. All right, we're going to do another one. And right about here, let's do a deep breath and hold it, all right? And let it go. Let's go up another one. And another. And another. Keeping that head and those shoulders nice and loose out in front of you. Make sure those knees are still soft. You can sway, all right? Now on this breath, we're going to lift our shoulders up towards our ears. And then on the out breath, we're going to pull them back and drop them down. And your head's going to come up too. All right, ready? If you're a neck cracker like me, that's a good time to do it.
Man, and you can just feel, I feel it. I feel my blood is moving better. My back feels so grateful for that. And it's opening up that whole spinal column so that now when we move, we're not stiff, we're not stuck, all right? Now, I'm going to do a few more videos, probably today, with some other exercises we can do. But I would say, if you're capable and if your doctor says you're okay, try and get up and do this with me every day. Try and get up and just do this nice breathing, deep breathing, flexibility. And like I said, if you have a limitation, if you're only allowed to go to 90, don't even take it to 90. When you get to here, start with going back up, right? Don't hurt yourself. So do stuff like that. Also, like, as you know, you can twist your upper torso a little bit, get those arms up over your head, stretch out a little bit there. Anything that you can do to just let your body be open, let your body relax and your muscles open up. That's creating blood flow, that's helping to get all of the leukocytes, I don't remember the name, but it gets the good stuff to your injury area so that your injury area can flush out. I had a huge bruise that went from, so you want to see my incision? It's tiny. So there's my incision. Boop. Nice little bikini cut. And I had a huge bruise that went all down my leg and down into the front of my leg and stuff. And I just have done these stretching and breathing exercises, gentle massage. My leg is still numb. I don't know if yours is, but I just do a lot of gentle massage. And just in the outsides of your knees, your IT band is almost definitely going to be sore from this surgery. So just gently rubbing your leg. And that helps to get all of the fluids moving, getting everything that might need to drain out of there. And so that starts with loosening up your body, getting all your fluids moving through you, and then, you know, manually helping that out too. So that's the beginning of the story. I'll continue to do these videos and tell you more about what I've done to make my recovery so fast. I've had people tell me that they don't believe my pictures, they don't believe my videos. I don't know what to tell you except that I've made my recovery journey my job. It's my full-time job right now. If I'm not doing anything else, I'm working on my recovery. And when you look at it that way and when you treat it that way, you have better results. And I would say another huge part of this is the mental game. And I'll talk about this more at length in another video, but if you don't believe that you can get better, if you think that you're an invalid now, if you think that you are permanently handicapped, you're already starting yourself in a place where you're not going to get better fast because you're thinking that way. If you think to yourself, hey, I'm strong, I can do this. I can walk from here to here. And your body's going to respond to that. Your body's going to say, yeah, I'm strong. Think about your muscles. Think about what needs to be contracted. If your glutes aren't contracting, if your calves aren't contracting, use your brain and send a very direct message to that leg. Hey, contract that glute, contract that calf. Make it work, So just have a good mental game. Going into this, believe that you can get better. Believe that your body is strong, because it is. Bodies are miraculous. Yeah, we gotta take medicine. Yeah, sometimes we need to go get surgery or whatever. But our bodies have everything that they need to fix themselves. And diet, and I'll go over this one too. Eat well. Take good care of yourself. I definitely have gained weight just because I can't exercise the way I normally do. I'm not out there walking 5 to 10 miles, but I've tried to eat good things. People are gonna bring you food while you're recovering probably, and you're gonna eat it. But once that food runs out, start eating healthy again. Start eating salads. Start drinking kefir. And if you got antibiotics while you were in the hospital, you want to rebuild the positive flora, rebuild that biota in your stomach and your gut, because that's part of your immune system. It's going to help you heal. So drink things like kefir, take probiotics, prebiotics, stuff like that. Try and build up that gut flora again. Try and eat lots of fiber so you can poop. It's really hard to poop after surgery. Take your stool softeners. Drink some Smooth Move tea if you need to. Make sure that you're going to the bathroom. Eat your beans. But yeah, just positive attitude, positive self-care, diet, and just doing these things that open your body up. Give yourself all of the advantages of being open, all of the advantages of being relaxed and stretched out. Give your circulatory system a little punch. All right. So I'll be back and I'll tell you guys more about what I'm doing. I'll elaborate on the diet thing and the mental state. We'll do some more deep breathing techniques, and we'll definitely do some different stretches and stuff. Again, I'm not a doctor. I'm not even anything close to a doctor. None of this is medical advice. Please talk to your doctors before you do anything you see me doing. Just get permission. All right. Happy healing. I wish you much health, and I guess I'll see you guys soon.